continuous functional MRI as the artist is painting or doing something lying inside the MRI gantry. That has never been done. But it's much easier to do it the other way, this circuit, because you can actually put an image inside the gantry. I'll show you how you do it. An image inside the gantry and then record the brain activity, which areas are being stimulated. But exactly that sort of study has been done. Now, we have talked about the ventral system and the dorsal system and how they may be involved in visual artistic production and visual artistic appreciation. But what about hardcore clinical neurology? What disorders may affect this system? The classic disorder which affects the ventral system is semantic type of frontotemporal dementia. And what happens to artists who have got a ventral stream disorder? They can paint beautiful paintings but doesn't understand the meaning of it. They will paint a bird very beautiful, you can see. But if you ask him, what is this? They won't be able to tell. They can maximum say this is an animal. Okay, how does it differ from a monkey? He doesn't know. Such a case has been described by Bruce Miller and al. In 2004 in a patient with frontotemporal dementia. On the other hand, bilateral dorsal system disorder is called balance syndrome. And balance syndrome can result from a number of neurological disorders, multiple strokes, progressive multifocal atrophy, some cases of Alzheimer's disease, and also in Creutzfeldt-Jakob disease. And the classical balance system syndrome consists of akinetopsia, inability to identify a moving object. The person will be able to identify a bird sitting here, but when the bird is flying, he won't be able to identify that it is a bird. The second is optic ataxia. That is inability to turn the eyes to an object of vision. I am sitting here and somebody calls me, hey, look at me. I won't be able to turn my eye. But otherwise my external ocular movements are quite full. But I won't be able to turn to a desired object. Similarly, ocular apraxia is, you ask me, you touch this chair. I turn my head, I can see the chair, but I cannot touch it. That is ocular apraxia. I can see it, but I cannot touch it. And the last one is simultanagnosia, which means inability to perceive a visual scene. What is the visual scene in front of me? It's a big table, and all of which you are sitting here with beautiful dishes of chicken legs and all this put in there. If you ask me to paint it, what I will paint probably Shagor, I will paint Amitabh here, one chicken dish there, I will be able to do it. I can't paint the whole thing. Such an artist has been described with multiple strokes by Smith and others, again from Bruce Miller's department, who had paintings capturing only small pieces of the scene. He could not grasp the whole visual scene which was presented to him. So these disorders are not just theoretical, they have got definite clinical importance. Let's come to hardcore neurology and artistic creativity. And the subject which has been mostly studied is artists with dementia. And Bruce Miller and Howe in 2004 wrote, documenting the artistic deficits or strengths that develop after focal brain injury allows the generation of a map of the cortical regions involved in different components of visual creativity, helping to distinguish the roles of the dominant and the non-dominant hemisphere now. What we have said before, that the creative center for art probably lies in the non-dominant hemisphere in the inferior parietal lobe. But please don't go out of this hall thinking that it is only our non-dominant hemisphere and the inferior parietal lobe that helps us to create art. Both hemispheres must work unison, in harmony, not in dichotomy, for any kind of creative work. That is the principle of creativity, neuroscience of creativity. Whether it's mathematical creativity, whether it's artistic creativity, whether it is simple driving, When you are driving, if you consider driving to be a creative work, when you are driving, that is the left hemisphere, because that is motor activity. But while you are driving, you have got a visual map of the roads, where you will go. You go straight, right turn, then again left turn. That visual map is there, that is stored in the right hemisphere. You need both of them. You can't just drive like that through the street and reach your peerless area from my house. So you need both of them. So both right and left hemisphere. So same thing about art. The disease in which this peculiar phenomena of de novo development of artistic creativity has been studied is frontotemporal dementia. And this is the first patient of Bruce Miller described in 1998. This is a lady in her mid-50s who had no previous training in art, and she never painted in her life. Suddenly at the age of 54 or 55, she started these beautiful paintings. This is a river, these are horses, very beautiful. Within a few years, she developed typical features of frontotemporal dementia. But the artistry came first, and then the frontotemporal. She never painted before, no training in painting. Now, quite a few of these type of cases in relation to frontotemporal dementia have been described since then. And this phenomena has also been described in a patient with epilepsy with a left temporal lobe focus, and another patient with subarachnoid hemorrhage and bilateral middle cerebral artery aneurysm. Well, I will show you that case later on in my talk in another context. But the last case, but the most recent case, is also very interesting. And this is described by Alan Liu from Bruce Miller's department at San Francisco in 2009. And this is again a man in his mid-50s who had no previous training in art, and he never painted in his life. And he suddenly at mid-50s started painting these beautiful pictures with great geometric details. And very soon he developed executive dysfunction as well as word-finding difficulty, which are very characteristic of frontotemporal dementia. As his disease progressed, the frontotemporal dementia, he started more beautiful paintings, and he even painted this one, which is really very beautiful, these two animals with great geometric details, with triangular lines and all that. But then he developed weakness and wasting of muscles, and he was diagnosed to have amyotrophic lateral sclerosis, which is a form of motor neuron disease as well. And the association between frontotemporal dementia and amyotrophic lateral sclerosis is well documented because they have a common genetic link. In life, and this person continued to paint